So another example is an antiparasitic drug. So this is an application of this is a mass drug application of ivermectin. Ivermectin was initially a roundworm infection agent used to treat farm animals. And then later on it was found that it also treats river blindness and other infections. And very recently it was found to be also active against mosquitoes, and especially at the very certain mosquito, which is the main vector of malaria. So ivermectin was given to 260 million adults alone in 2014, and these numbers increased for river blindness. And the one idea to fight malaria is now to really do a mass drug application of ivermectin to many people to really kill those malaria vector mosquitoes. So the thing is, if a malaria mosquito bites a person with ivermectin in their bloodstream, the malaria is still given to the person. However, the mosquito dies afterwards because it has the ivermectin in the blood taken up. And this really then kills all the malaria mosquitoes and should get this in control. But if you apply a certain drug to so many people, it's very important to follow up closely and to know exactly about the side effects and therapeutic levels, etc. And here as well, we're dealing with large sample amounts, which need to be analyzed very cost effectively. And here DBS comes into play. So take a little bit to get an idea about the correlation between plasma, venous blood, capillary blood, and dry blood spots, which is often a topic of discussion for dry blood spot methods. We performed a correlation study. Here the same individuals took ivermectin and they gave venous blood, capillary blood, and dry blood spots at the same time, and then these curves were compared. As you can already see in the picture, the curves of ADME, they look very similar. And if we do some plots, so on the left-hand side there's plasma and venous blood, looks very nicely correlated, then venous blood and capillary blood. And on the right-hand side, there's capillary blood and dry blood spot. And in all three graphs, we see that most of our results are within the acceptable window, which then gave us the go to really develop the method and to go one step further. So here, it was basically a very easy separation. However, we wanted to really separate the matrix from our compound. So we run a very fast gradient on the C8 column. The method takes a little bit more than 3 minutes and is also done with water and methanol containing some ammonium format as buffer. So the QC samples look very good during the validation. Speaking of hematocrit effects, as well, here we used the very same approach as described before. We prepared the calibrators with a medium hematocrit here of 40%, which then gave us the result back that all our results, they are in an acceptable window and within the validation guidelines. This then allowed us to do a clinical validation and showed that DBS is really a method which can be used in a clinical setup for ivermectin.